Good morning, it's Dr. Garrett, and we are here at Empowering Health. This is the lovely Susan. She is a nurse practitioner here as well. And so today we wanted to talk to you a little bit about the thyroid and thyroid health. This is a very common thing that we see in practice, and I have seen in urgent care and emergency medicine, and even at the free clinic, are people who have issues with thyroid. But we don't always understand what the thyroid is, why it's doing what it's supposed to, and how we can help it, and then other things that can cause issues within the thyroid. So first things first, I want to talk a little bit about the anatomy. So within the brain, we have this little bitty gland called the pituitary gland. Its job is to be like checks and balances for several different things within the body, but one of them is the thyroid. Now the thyroid is this butterfly-shaped gland that sits kind of here at the base of the neck, kind of where you would tie a bow tie. And what it does is it secretes one form of inactive metabolism and one form of active metabolism. So the inactive is T4. T4 is a little protein with 4 bonds on it, and each of the end of those bonds contain an iodine molecule. And what happens is within the thyroid and within the tissues of the body, one of those iodine molecules will break off, and then it becomes the active form of metabolism called T3. So that's basically how we get the names, is one of those bonds breaks off, and now we have 3 bonds. So then what happens? So if in the body our T4 levels are low and our thyroid isn't secreting enough metabolism to be converted to T3, then the pituitary gland says, uh-oh, this isn't right, let's fix this. And what it does is it will start creating and excreting more of this thyroid stimulating hormone, TSH. Now, the TSH is going to tell that thyroid to go ahead and start creating more T4. However, if we have disease or if we have problems or even autoimmune issues such as Hasimoto's thyroiditis within the thyroid, it is not going to secrete that T4 that could be activated or converted to T3. And there are lots of reasons for this. So Susan?
Yeah, so like you said, lots of things affect thyroid health. I think the first thing that we want to look at is, environmental factors, other drugs that you may be taking or other supplements, and then your food. So we were talking about there's certain forms of estrogen that people like in birth control pills or other forms that can affect your thyroid function. And it actually affects the test numbers more so than it affects the function itself. The same thing with biotin, which is a really popular supplement.
Absolutely.
You see it all. It says, grow beautiful hair, long nails, take biotin. But those can actually affect your numbers as well. So you want to make sure that it's not, that if your thyroid numbers come back a little wonky, that it's not just because of the supplements you're taking.
Right.
And then the second thing is, what's in your diet. We talked about the iodine bonds. So if you're not eating iodinized salts, which is, I think there's much more of a swing towards the natural salts, the Himalayan salts, the kosher salts that do not have the iodine in it, you could have an iodine deficiency, which could affect your thyroid numbers as well. And then we talked about what's good for your thyroid earlier. We talked about like kelp and seaweed. Most of us are not eating that unless you're a huge sushi fan, maybe. And then the farm fresh eggs have higher levels of iodine in them as well. And then what else did I talk about?
And selenium.
Selenium. Yes.
Selenium is a very important one. And we can get that from things like Brazil nuts and even the eggs. Those farm fresh eggs will have higher levels of selenium.
Yeah, Brazil nuts and macadamia nuts and hazelnuts those are all good sources of the selenium that supports thyroid health as well.
And I think that's really important because I know in our family we use the Himalayan salt for our seasoning because it's a healthier alternative. So if we're not getting that iodine from some other sources, then we could have some deficiencies in there, and then we're not going to have the right covalent bonds in there in order to metabolize and to make things feel better for us. So it's important that we're paying particular attention to our diets as well. Now, in terms of medications, when we talk about thyroid medications, we have one that stands above the rest for hypothyroidism, and that is Synthroid. Synthroid is an oldie but goodie. We have used it for 70, 80 years at this point. However, what levothyroxine or Synthroid is T4. It is not the activated metabolism T3. It is only one hormone. So essentially, we've been giving one drug to cover the job of 2 hormones, hoping that it would convert within the tissues and within the thyroid itself. However, some people, they will go on Synthroid, their TSH will be normal, but then they're not going to feel well. And that could be because their T3 isn't activating the way that it's supposed to. So there is a push to add other medications like Cytomel, which is T3, and even low-dose naltrexone, which we know is Narcan. When given at the low dose, it can work on autoimmune issues such as Hashimoto's thyroiditis to make you feel better when levothyroxine or Synthroid isn't cutting it. And another one that Susan and I were talking about earlier was the Armour Thyroid.
Right, and the Armour Thyroid is actually T4 and T3 together. And the idea behind that is, if you're going to be low on T4, you're going to be low on T3 then. So we give them both to hopefully that you'll feel better faster. Because when your thyroid levels are off, you just feel awful.
Absolutely.
So we're hoping that, in hopes that converts quicker, and so you feel better faster. But if you are taking Synthroid, if you've been prescribed Synthroid, and you've been on it for a while and it doesn't seem like you're feeling better, you want to make sure that the testing that is being done on you is the appropriate testing.
Absolutely. When I first started my practice, I was trained that you check TSH. If TSH is high, then you're going to give Synthroid. If it's, looking kind of normal, then you leave it alone. But that doesn't always correlate to how your patients are feeling either. It wasn't until recently that I realized that we need to be checking other markers within the body. We need to be checking our T4s, but moreover, we need to check T3 because that is our active metabolite that is going to help us to feel better.
Right.
And then Susan was talking about some other testing as well, such as like antibody testing and making sure that your primary care doctor is testing appropriately so that we know what's going on with you.
Right, and it's all about the holistic full picture of your thyroid. It's not just 3 numbers on a piece of paper. So it's your diet, it's your environment, it's your supplements, and it's your blood work.
Absolutely. And just making sure that you are a good advocate for your own body. We want to empower you to take charge of your health. So if you have thyroid issues, if you have Hashimoto's thyroiditis or hypothyroidism, it's important that you're looking at the full picture like Susan said. Make sure that all of your levels are where they're supposed to be. Make sure that your diet is on par so that you can feel better. Now, with a lot of these testings, if you don't have a primary care doctor, Susan and I, we can help you out here. We can do your blood work. We can, lead you down the path, prescribe different medications that can help you. So if you have any questions or if you want to get in with Susan or I, give the office a call, 812-290-2128. We hope you have a lovely day.